Yeah.
Good afternoon, good evening, good morning, wherever you're listening to us from this afternoon. I am delighted to have Dr. Nyjon Eccles back with us today to talk about bioidentical hormones. So before we get started, though, I'd like to do a brief introduction of Dr. Eccles. For those of you who may be new to him, I know a lot of my followers are very well versed in who Dr. Eccles is right now, but nonetheless, Dr. Eccles is a very respected integrative medicine physician in the UK, and he has been at the forefront in the use of pioneering innovative and groundbreaking natural health care over the last decade. He holds a lot of medical and academic qualifications. He's also a member of the Royal College of Physicians. He also holds a PhD in pharmacology. And Dr. Eccles specializes in thermocheck, which is breast thermography, natural menopause treatment, including the natural bioidentical hormone replacement. He also has better aging programs and natural biogrow hair restoration. Dr. Eccles has had a lot of interviews and conferences that he has posted online. I know many of you from my side have seen some of these. So if you want to check Dr. Eccles out, please, if you type into YouTube, Dr. Nyjon Eccles or just Dr. Eccles, the information is astounding that he has available to us. He also has a very wonderful website as well. And what we'll do at the end of this video is we're going to post all of his links in there so that you can also have information that, that is very pertinent to your health and well-being. So thank you, Dr. Eccles, for joining us here today.
Nice to be with you again. I hope it's not too late to say Happy New Year.
Not at all. It's only the 23rd and it feels like it just ended. So I don't know what time
Absolutely.
vortex I'm in, but it does feel like New Year's
Yeah,
Day was just yesterday.
absolutely.
So
Yeah.
thanks for joining us. I want to talk
Hmm.
about a very hot topic, and I know that
Hmm.
you're very well versed in bioidentical hormones, and
Hmm.
it's something that, myself, I shared with you earlier, and I'm very open in sharing with my people as well, the things that I go through and what works for me. And I shared with you that
Hmm.
I'm also highly considering going down that route myself. And I'm sure by the end of this interview today, the education that we'll get from you, I will probably be calling to sign up. So so let's talk about bioidentical hormones. I'm going to stop and pass it over to you. Let's dig right into it.
Okay, so I suppose to define the term would be a
Right.
good
Great place
start.
to
So,
start.
and there are some doctors now referring to them as body identical hormones.
Body?
Uh, Body identical as opposed to bioidentical.
Okay.
And and really, I think this is just semantics. I mean, it essentially means the same thing. The only difference is body identicals. I tend to refer to the ones that are available on a well, in the UK on a National Health Service prescription, and there's a very limited availability of these body identical. Bioidentical is being left to describe all other sort of compounded forms of hormones which are identical to the molecular structure of the hormones that the body produces. So that's the definition. What is a
Okay.
bioidentical hormone? It's a hormone which is exactly the same molecular structure as the ones that our body produces. So if we're talking about estrogen or progesterone or testosterone, DHEA, identical in structure to the ones the body produces, as opposed to conventional hormone replacement. And the distinction there is they tend to use patented synthetic forms of the hormones because you can't patent a natural molecule. That's the problem. And so, from an industrial perspective, an economic perspective, there's not much interest in these natural molecules because they can't be patented. But if you put a little sidearm onto the molecule, create a hybrid of that molecule that's patentable, it then becomes a form of the hormone, but not identical to the one produced in the body. So unfortunately, as we'll talk a bit later, when that happens, it tends to change the way it works. It has similar effects, but then tends to produce side effects as well. So hence, if you look at the data on the two, there can be completely different bioactivity depending on the structure of the molecule. Yes, just a tiny little change to the molecule can completely change its bioactivity. So so bioidentical anyway, I'm diversifying a little bit too much maybe at this point, but bioidentical means exactly the same structure that the body produces. Yeah. So
Which is very important. And
it
most
is
people understand
important
why.
because it's the way the body handles molecules it's used to seeing is very different from the way it handles molecules that it isn't used to seeing. So, the whole hormone story started out with using, pregnant horse uh, estrogen derived from urine. So, Premarin, for example, we call it in your is derived from pregnant mare urine. Now, is it bioidentical? Yes, for horses,
Yeah.
but it's not bioidentical for humans because the main estrogen is called equilin, and it's a very different molecule to the estrogen that we produce. And we can talk a bit more about the different types of estrogen because there are three main ones. So, so the bioactivity of equilin is very different to, say, estradiol, that is the main active estrogen that humans produce. Very different. And a lot of equilin is converted by the body to estrone, which is one of the negative estrogens. It's the one that causes most negative impact. So why use a hormone which can have lots of potential negative impact when we can use a hormone that the body's used to handling, has all the machinery for responding to it, taking it, excreting it, all the machinery, the enzymes to break it down are all in place to do that in a way that is safe
Hmm.
and protective. So I think one of the problems with the synthetic forms is that they're not handled by the body in as easily, and hence you tend to see the negative impacts.
Mhm.
Yeah.
Um, so I don't know how far ahead I want to jump in here, but I'm going to throw out some questions that I know
Mm,
that have come through from a
mhm,
lot of my female clients, right? Is
mm, mm,
a couple of things. I know we can talk for hours about bioidentical hormones. I would hope, and if people aren't sure what those are, then I'm going to direct them to your website, Well Nurture website. There's
mm,
lots of great information up there, lots of great books. But a couple of things. So, uh, you know, what symptoms and or at what age should
mm.
a woman consider looking into bioidentical hormones, getting tested? Is it right? Is it wrong? Because again, there's a whole lot of, and I'm just going to be blunt, there's a whole lot of misinformation potentially out there on things like, TikTok and all these various platforms. So can we talk about that, Dr. Eccles?
Yes, it's difficult to answer that one precisely because often the women that come to see me, there's two main reasons they come. Okay. One is that they are symptomatic, so
Mhm.
they're either creeping into perimenopause, they're still having periods, but they're starting to experience some of the hormonal changes in the perimenopausal period, and they're becoming symptomatic. So, and of course, women who are in menopause, and 80% of women will have some kind of symptoms from entering menopause, be they emotional or physical. Well, it's the symptom occurrence that drives, I would say, probably 80% of women to my practice.
Okay.
Symptom. They want symptom relief. They want to get their hormones in balance, or they want their hormones replaced in as natural a way as possible. Okay. So the other 20% of women who come to see me come because they're being proactive and they want to do something about aging.
Mm.
So they know they can't stop aging, but they want the transition as they get older to be very easy. They want their skin to be maintained. They want their bone health to be maintained. They want some of the tissue integrity effects of the hormones to weigh in. So they're being proactive. They're not necessarily symptomatic, so they want to be proactive about the aging process. And they've read, most of them, they're very well researched. They've read that the hormones can have an impact on the process of aging, and they're right. They can, and if they're given in a natural way, the beauty of this is that they can be used long term to get all of the anti-aging benefits without the negative downsides that we see with conventional HRT.
Right.
So and most people are aware of those downsides, increased risk of breast cancer, myocardial infarction, increased risk of stroke, increased risk of clots. These are all the things that unfortunately can be associated with conventional HRT, and why doctors shy away from using them longer than 5 years, because it's as the risk compounds as you get beyond 5 years. Whereas we don't see the same increased risk of those things with the natural forms, the bioidentical forms of hormone. There's lots of studies now that confirm that.
Okay. And when you're talking about the risks, and again, the HRT, I think that that's very, well talked about, but are there risks, Dr. Eccles, that a woman would have to be aware of, as she's considering bioidentical?
Uh, well, with all hormones,
Mhm.
hormones are potent. What I will say about my experience of using them is they have profound impact. And this is one of the things that makes it exciting to use. I mean, you can so many women uh, are are transformed by their hormone replacement. A lot of women say, oh, I feel like I'm myself again. I've got myself back, and and that impact can be quite rapid. So hormones are particularly potent, but they're at the flip side of that potency is that you've got to get the dosage right and the balance right for the individual. There isn't a one glove fits all here. There isn't a one dose suits everybody. So the night I think the nice thing about BHRT, bioidentical hormone replacement, is that it's usually tailored to the individual. This is very important because
Mhm.
what one woman's requirement for estrogen or progesterone is not the same as another. And you have to get the balance right for the individual. When you do, the good news is you don't need to change it, or very rarely you need to change it over time. But getting the question, in answer to your question, are there risks? There are little in the way of risks in terms of heart attack, breast cancer, strokes and clots. We know that, but you still have to get the balance right for the individual, because if you don't, then there can still be side effects
Mhm.
from not having the balance of hormones right in that individual, because they are potent. And if you take too much of them, you go up the other side of the scale. You have unnecessary side effects. So what I would say is if they're prescribed and monitored correctly,
Mhm.
very little at all
Okay.
in terms of risk.
Okay.
Now, if you have, because I have a lot of clients who come to me who may even have a family history of breast cancer, so they have you have a familial risk of breast cancer. That doesn't mean they can't have hormones, but you just have to be mindful of how you would lower the risk. There is no risk associated with the hormones themselves, but there are other ways that you can mitigate the risk in someone who has a family history. And we talked about some of those things, I think, in our
Right.
last talk, vitamin D, iodine, and all of that stuff, making sure the estrogen metabolic pathway is functioning well, so they don't produce toxic estrogens, all of those things. So um, uh, I've gone off. I've forgotten
That's okay.
why I was saying this now.
That's okay. That is definitely one part though that I would like to do a refresher on. So we can kind of bring you back.
Yes,
So you
sure.
were talking about we were talking about any risks, right? And
Risks.
risks with
Yes,
especially with women who have breast cancer.
yes, Now
Sorry.
women who've had breast cancer, let's talk about women who've had breast cancer. Can they have hormones? Because the answer is yes, they can. But if someone has an estrogen receptor positive breast cancer, you don't want to be giving that woman estrogen.
Right.
Even if they're in remission, I would be hesitant. Now, there are some doctors who are a bit more bold than I am, because there are forms of estrogen which are actually protective of breast health. You know, estriol, the weakest estrogen, there's evidence that that protects breast health. And then you've got a form of estradiol called 2-methoxyestradiol. There's interesting data coming out of that that it might actually be anti-cancer. And I see my space has been invaded by my 4-year-old son.
That's
So,
okay.
so excuse the intrusion. Oh, he's just come to collect something. He's gone out again. All right.
No worries. It's all about families anyways, Dr. Eccles. So you know what? This is perfect. It's all good. He's fine.
He doesn't care at all. What dad's up to?
Doesn't
Anyway,
matter.
no. So Nisi, I've lost my train of thought now.
Yeah, so we were talking about the different types of estradiol, which was another question that I had wanted us to define. So
Yes.
you said
So
estradiol.
yes.
Okay.
So you'd be very, very cautious about the use of estradiol in a woman who has a history of estrogen receptor positive breast
Mhm.
cancer. But here's the good news is that there are ways of replacing some of the other hormones in bioidentical form that is completely safe, even in a woman who's had previous history of breast cancer. So, and you can look at things like DHA and pregnenolone, progesterone, even. It can be used safely. I think progesterone is a great breast protector, and there's lots of data for suggesting that progesterone has actually an anti-cancer effect as far as
Oh,
the
okay.
breasts are concerned. And I'm sure some of your listeners might be saying, yeah, but what if you have progesterone receptor positive breast cancer? What about that one then? And I tell you, there's a lot of confusion over this even amongst doctors because in 2015 there was a study published in Nature, huge journal, highly respected, one of the leading scientific journals. And where they looked at this issue of progesterone uh, receptor status, and actually what they found, and no one ever followed it up in terms of therapeutics, they found that if you were progesterone receptor positive, what that meant is that you are more likely to respond to progesterone in a favorable anti-cancer way. In other words, that would modulate the effect of estrogen in a positive way. So nobody followed that through and said, well, hang on, why don't we use progesterone in women with progesterone receptor positivity? Because currently there is no therapeutic around that. If you're a progesterone receptor positive status breast cancer, there is no therapy to give you a progesterone blocker or to even consider using progesterone. But that paper suggested use of progesterone would be favorable. So if you then translate that back to a woman who maybe isn't progesterone receptor positive with a history of breast cancer, could you use progesterone as a breast protector? Absolutely. All the data around natural progesterone I'm talking about
Right.
suggests it's protective against breast cancer. So you can use progesterone, DHA, pregnenolone, but you monitor it. This is the key thing. You
Mhm.
monitor it to make sure that those pre-hormones are not being converted to estrogen. And I can tell you from experience that they don't. They don't. The estrogen level stays flat. Those other hormones do their thing. Woman feels much better. So you're still supporting that woman hormonally without using something that could potentially drive, a latent disease process that they might have there. So, so we're actually ended up talking about more complex issues early on in this.
That's
But
okay.
but these are some of the big questions I commonly get asked, is that okay, because you asked the question on safety,
Yeah.
and I think across the board, bioidentical hormone replacement is safe if it's used correctly, if the balance, you find the right balance for the woman, can even be used, some of the elements can even be used in women who have had breast cancer without driving the estrogen status. So, so the answer is yes. And um, I remember uh, all the anti-aging conferences that I've attended in my years, and all the doctors doing serious anti-aging medicine use bioidentical hormones in their practice because it's very difficult to get the tissue integrity benefits that you get from the hormones with other modalities. You
Mm.
know, the hormones are critical to the aging process, and it's why, unfortunately, in women, when the hormones fall off, whatever it is for between 45, 55, they fall off quite sharply. And that means that you lose some of the benefits quite quickly of the hormones. In men, it's sort of much more gradual drop. So, um, so the good news is though in that is that when you restore the hormones correctly, is you start to get some of those tissue benefits back again.
Okay.
So it's clear, very clear from both clinical experience and from published data that you can get some of those tissue restoration effects occurring, whether that's brain or skin, bone, protection of the heart. There's lots of benefits
Mm.
that come from these, and that's why when I think about bioidentical hormone therapy, I don't just see it in terms of symptom relief, which they do,
Right.
but there's a story to be told about how these safe hormones can be used as anti-aging tools.
Mm-hmm.
That's
And
the
that's
biggest story.
and that is a bigger story because there's so many things that happen to us as we age. And this week I have a colleague of mine and I, we have Dr. Brian Clements coming from Florida, and he runs
Hmm.
the Hippocrates Wellness Center. And we're
Hmm.
talking about vitality, right? And
Yeah, yeah,
aging
yeah.
gracefully and aging with vitality versus aging with disease.
Yes,
And a lot
yes,
of times people think
quite.
about anti-aging as, skin creams and stuff like that, which again,
Yeah,
yes, all
that's right.
good. But anti-aging from a bioidentical hormone perspective and from my research, it is ensuring that you're giving yourself the best possible outcome to ensure that as you age, you're aging with that vitality and longevity versus the sickness and the disease that can come along with aging. Is
Exactly.
that correct? Okay.
Exactly. So it's disease prevention as well. That's the other, because when I talk about anti-aging, what I really mean is not just the, looking youthful as you get older, but also that your internal tissues also function better. The structure of them is improved. All of these are all potential benefits of having the hormones on board.
Right. Something that you said, and I want to highlight it because I have a lot of female clients and we've had lots of conversations. And the sad part of it is, Dr. Eccles, too, and this is for my listeners out there or any new listeners, the really important piece that, that Dr. Eccles has touched on as well, too, a couple of times is monitoring it
Mm.
is really important. So, going to get bioidentical hormones off the shelf from somewhere and treating yourself is not in your best interest at
No.
all.
Mm.
Um, and monitoring it so that when you do start, if you do start down the path of bioidentical hormones, that you don't just, try it for a day or two and then
Yeah.
give up, right? So
Hmm.
it's
Hmm.
a process. It's not a one and done. It's not an
Hmm.
immediate, sometimes,
Hmm.
most times I'm sure it's not an immediate thing, but
Hmm.
also just as important as starting it is also following up with your appointments with
Hmm.
the physician that's working with you to ensure that you are monitoring it to make sure that they're getting the right dosage. Very important.
Yeah.
Thank you, Dr.
Yeah.
Eccles. Can we take a step back? I know I jumped you right into the some of the harder discussions, but can we also talk about last time we talked, and again, I want to do a highlight of this again and talk about it because it's so important, is the estrogen methylation and what we can do proactively to ensure that, those estrogen are methylating. And hopefully said that correctly, but we talked about, some vitamin D and some other things. Can we talk about that?
Yeah. So, excuse me. So estrogen is broken down in the body in two stages. Yeah, so there's a phase one detoxification and there's a phase two detoxification. So methylation, as you mentioned there, is phase two, but it's first there's a hydroxyl group which is put on it. So it's a hydroxylation process which helps to detoxify estrogen, but it's phase one. It then goes through a second phase, which is methylation. So now all women do this. All women do this. Men do it too, because men also produce estrogen and they have to detoxify it. Um, so and they will do there are certain estrogen byproducts from this detoxification that are present. So, for example, the commonest ones are we have 16 hydroxyestrogen, 4 hydroxyestrogen, and then 2 hydroxyestrogen. Okay, so this is, so and they have different effects. So, for example, 16 can have a negative impact on hormone sensitive tissue, so estrogen sensitive tissue, breast, for example.
Okay.
4-hydroxy is probably, the one that has the most mutagenic, meaning it can mutate cells. And then 2-hydroxy seems to be neutral, it's safe. So now all women will produce a mix of these, and if you produce an excess of these toxic estrogens, potentially that can damage your breast tissue or your uterine tissue, which is another estrogen sensitive tissue. So and the amount of these that you produce is really dependent on your genetics, on which enzymes are active in that breakdown process. So here's the thing and we mentioned this last time, is with phase one estrogen detoxification, you can improve your detox profile by just ingesting cruciferous vegetables. So broccoli, kale, cabbage, cauliflower, Brussels sprouts, watercress, all of that family, they have certain compounds in there, certain indole compounds, which cause the body to switch to producing the neutral estrogens. So in other words, your body then starts to uh, push estrogen down the safer metabolic pathway. So you don't produce as many toxic estrogens. That's one. And then phase two, methylation. That's how you the sort of second phase of taking estrogen safely out of the body, this methylation process. And methylation can be supported by or improved by just making sure you have enough B vitamins in the diet. Even if you supplement a B complex, it's probably the easiest way. This will help you to be the second phase of estrogen detoxification to arm that, make sure that that is functioning well, and then you're not producing an excess of these potentially damaging estrogens. So, and that is what we do, by the way. That is what we do in clinic is if a woman has a family history of breast cancer, particularly, or she's had breast cancer, I test their estrogen metabolism profile
Okay.
just to see, are they a toxic estrogen producer? And if they are, there are these simple nutritional tricks that you can use to, well, it's really a genetic effect. What you're seeing here is an impact of these nutrients changing gene expression so that you then produce the enzymes which produce the safer estrogen. So it's a nutrigenetic effect where you're changing a gene expression because of certain nutrients that you're putting into the environment. So that's quite empowering because it means that, well, not quite empowering, it is empowering because it means that even if you have a genetic risk, that those gene risks can be modified by the environment that you put into the body. See, that's very exciting. So, but these are just a couple of ways that you can reduce risk of some of these toxic estrogens, you know. Um, and we do it a lot in the context of, breast health maintenance, breast cancer prevention. These are just, a couple of things that we employ strategies. And you can see when you retest this estrogen profile, estrogen metabolism profile, you can see that it changes.
Mhm.
So, by adding in these nutrients.
Right. So, question for you, and you might not be able to answer this for all
Mm,
bioidentical hormone clinics, but maybe just your own. So, is that
mm.
like a standard test that's done when you first start down the path of investigating, your profile for bioidentical hormones?
I recommend it. Not all
Okay.
women do it because, it's another cost, but ideally it should be done. Now
Okay.
there are some doctors now who, as part of their hormone monitoring, use a urine test to monitor the hormones as well. Now, if they do that, they will have this information built into the test.
Okay.
Yes. So, for example, there's a test called the Dutch test, which some of
Yeah.
your listeners will be familiar with.
Yeah.
And that tests the hormone levels, but also the estrogen metabolism profile. So
Mm.
it's all built into the one test. Um, I actually prefer blood myself to monitor
You do.
hormones. I find it more reliable.
Okay.
But I then do this separate urine test.
Okay.
It's good if women can do it.
Okay.
I particularly do it if there's any family history of breast cancer. Yeah. So if there's
Very good.
a family, it's important to do it. Yeah.
Okay. And that's the separate urine test. And you do prefer
Yeah.
the blood. And that's interesting. So thank you for bringing that up because again, information that is shared, right? Is you're trying to decipher what is factual and what is just somebody else hearing something and then and then sharing it. So for example,
Hmm.
um, I've heard in the
Hmm.
past that urine test was more accurate than the blood work. But it's the opposite. It's the blood work for hormones is probably, your higher level and then follow it up with the urine or
Yeah. The honest answer is that urine might be better for some things. It's
okay.
certainly better for looking at metabolites. You can't look at those in blood. I find blood is better for others. In an ideal world, if there was no economic restriction, you would do blood and urine together.
Okay, very
You would
good.
do both.
Okay.
But you've got to, as a responsible physician, and you're trying to let me just get rid of this. Sorry,
No worries.
we're trying to uh, uh, we have our patients' interests at heart. It's economically, it's not viable to do both for a lot of people.
Right.
So I just find my preference is to use blood for monitoring.
Yeah.
And sorry, one second. Yeah. So my preference um, is to monitor with blood, to use the urine for looking at estrogen metabolites. That's how I do it. Yeah, it works very well, I have to say,
Mhm.
in terms of patient progress, in terms of, seeing very satisfactory results. Works well.
Okay. And that's very good to know. So I'm glad that we brought that up so that the listeners can differentiate between
Hmm.
the two.
Hmm.
But also, I'm always about empowering with the information so that you can make an informed decision when you do start to do testing so that people can, now that they know blood and the urine would be best, we know that, bad estrogens, and if they're not metabolizing properly, they can cause a lot of havoc in a body,
Yeah.
especially, specifically around the breast tissue.
Hmm.
And we also know that, thyroid also has, big play in hormone regulation in the body and then impacts the breast tissue as well. Those two
Hmm.
always go hand in hand together.
Hmm.
So that's very important for women to recognize as well. When
Hmm.
you do, and I'm going to be conscientious of the time here, Dr. Eccles, because I
Sure.
know that you're a very busy man, and I don't want to take
Sure.
you too long, but because I could talk to you for hours. But um, when they do the bioidentical testing, or when you do it as well, do they also test iodine levels in the body with that test, or is that a completely separate thing?
No, that's separate.
Okay.
Yeah,
I
it's
thought it
separate.
was, but I just wanted to validate. Okay.
Yeah, yeah, it's separate. And again, you would want to measure iodine in urine
That's right.
as
Yeah.
opposed to in blood. Yeah.
Yeah, and that's what
So,
we do out of our clinic here now too. We have the blood testing from Dr. David Brownstein
hmm
in
yes, very
States.
good.
Yeah.
Well,
Yeah.
he's the iodine expert.
He is. Yeah. Learned a
Mhm.
lot from him as well too. So, okay, but
Sure.
I wanted to see because I wasn't sure if those two, did a crossover. So, very helpful.
Yeah.
Okay. So again, being respectful of your time, and I know that it's past supper time there, or it's getting very close to supper time. So we don't want to keep too much longer. But what else can you share with us to wrap this up that would be of most importance for women to hear as far as bioidentical hormones go?
Well, I throw in another bonus thing
Okay.
because because we sort of shied away a little bit from the sort of cosmetic effects of the bioidenticals. But here's another piece of good news is that you can use them topically on the skin to restore collagen and elastin. And so you can get nice sort of anti-aging effects from using topical bioidenticals. I mean, I years back sort of created a combination to use, but it can be even simpler than that. And some of these basic, hormones, if they're applied to the skin, it's amazing the effects you can see usually quite quickly, within weeks, you know. Uh, so not only do they have the restorative effect internally, but they do also have cosmetic benefits as well. And they
Hmm.
can be applied topically to the skin to achieve that. So in terms of, hydration, wrinkle reduction, increasing elasticity, collagen building, all of these things we know are important can be achieved by appropriately applied bioidenticals to the skin.
And that's fantastic because again, how many women are out there being sold to buy this collagen product, that collagen product, drink this shake, drink that shake that has all the collagen, and you know, some of it may work, may
Yeah,
not, but at the
yeah,
same time,
yeah.
you're
I'm not.
helping your hormones.
Yes, and I think, look, I think since you mentioned collagen, I think collagen probably does have a role. I think it does have restorative effect, but you usually have to take quite large amounts to get any impact on your joints and on your skin. I mean, for example, if you're using a marine collagen, usually you need to be taking, I'd say 10, 20 grams a day. If you're taking small amounts, it's not going to do anything.
Mm.
There are studies showing the range of impact with collagen is somewhere between 10 and 40 grams a day. But it's a pretty benign thing to take. It's usually a scoop in
Yeah,
your smoothie. And
yeah.
so, but excuse me. So I think collagen can have some nice effects, but it has to be taken in the appropriate dose.
Right. And again, taking it with your bioidentical, within that, you're helping inside and outside. So I love that. Dr.
Yeah.
Eccles, thank you so much again for being here with us today. I know there's so much more we could probably talk about as far as the bioidentical hormones go, but again, I want to be respectful of your time. I know it's already nighttime there. So I want to thank you. My viewers, thank you. And I'm sure that this won't be the last time we get to talk to you. So thank you again for joining us here.
It's a
Greatly
pleasure.
appreciate it.
It's a pleasure. I wish you and your listeners all the best, and we look forward to a part three sometime down the line.
Fantastic. Thank you so very much. I appreciate it.
All
Take
right.
care.
All the best. Bye bye.